30 years ago, a group of community leaders came together in Launceston, united by a shared vision to establish an independent fundraising body for the Launceston General Hospital to ensure medical research opportunities in Northern Tasmania weren't hindered by financial insecurity. This was the start of the Clifford Craig Foundation.
Today, the same hard work and imagination which was so valued by our founders has seen the foundation grow into a health promotion charity that funds medical research, staff education, medical equipment and even patient facilities within the LGH for the betterment of healthcare treatment for the people of North and North West Tasmania. It's the community that has made the Clifford Craig Foundation what it is today, and the development of this organisation over the past 30 years is a wonderful achievement. But it's important that we don't dwell on the past, but to continue to focus on the future and providing the ongoing support that assists our acute care hospital to be an even better hospital for the community that it serves.
Clifford Craig Foundation has helped us buy some very essential equipment here and also to help to bring research to our clinical practice. We know that good clinical practice is based around understanding research methods and techniques so that we only do the best evidence-based procedures and treatments. And the pieces of equipment we've been able to get so far have enabled us to do that. A couple of years ago we were able to get a FibroScan for liver disease, and now we've been able to secure a radiofrequency ablation unit to treat Barrett's esophagus. Patients prior to this would have to go to the mainland for treatment, would have to wait months, would have to be exposed to risks such as we saw with the COVID pandemic. Now they're able to get treatment locally, they don't have to undergo surgical options, and treatment can take a matter of minutes as opposed to potentially being in hospital or travelling to the mainland, which can take days to weeks.
The assistance of the Clifford Craig Foundation has allowed me to continue my work in neurological clinical trials, particularly in motor neurone disease and multiple sclerosis, which are two of the areas that I work primarily in. And it's allowed me to bring some clinical trials to Tasmania that haven't been done here before, which ultimately means that people have access to different sorts of treatments that they might not be otherwise able to access. When someone's living with an incurable illness like motor neurone disease, being involved in clinical trials gives us hope. Hope that we can make that individual's disease better or slow down the progression of their illness, but also hope that they can be part of something that's bigger than their own illness and bigger than their own journey through it. So many of the people that I know who have lived through a difficult illness like motor neurone disease really jump at the chance to be involved in clinical trials because it gives them that sense of hope, both for themselves and for the community more broadly. Without the Clifford Craig Foundation, I wouldn't be able to do the research that I do, not just the financial support from the Clifford Craig Foundation, but also the provision of expert clinical nurses and research nurses who really run the clinical trials unit here at the Clifford Craig Foundation. Without that sort of personnel support, we wouldn't be able to conduct clinical trials even if we had all the funding in the world. So those people are vital in allowing us to do this research.